actually got a bruise here.
Okay. Is that kind of where she's hurting too?
Well, it's up here.
Okay.
So we don't know if it's a PE, and I thought maybe pleurisy.
Yeah, come on.
Could be.
Or something to that effect. But you can see the bruising here where she had fallen lower.
Yeah, just about every day she's pretty much she
Where
falls.
is that bruise at? Where she?
Here.
Here's
I
the
thought it
bruise
was
is
in
here.
It's a little bit back.
But she's hurting up here, honey.
Sweetie, does it hurt when I touch here?
Yes,
Ooh,
it
real
hurts.
tender.
Okay.
How
So,
about up here?
No.
and I know she went down on that right side
Yeah. Okay.
the first time.
So when did the falls all start?
Oh, no. A couple
Well,
weeks
she's
ago,
had two.
right?
Yeah.
She's had both hips replaced.
Okay.
3, 1, and then she's quit eating pretty much in the last week and a half. She's pretty much just stopped.
Okay.
So, what's today? What is it?
Saturday.
She fell
Last
Thursday night. She fell Friday night, and she didn't fall at your house last night. But she's been falling off and on for a year. A good year.
Yeah.
This is more falls recently than usual though.
Yes. Yeah.
Oh my gosh. Okay.
Took her 2 weeks ago.
Uh-huh.
She's
Okay. All right. So this chest pain came on all of a sudden this morning. Was she short of breath?
Nope.
Wasn't acting like she was hard to breathe, nothing like that?
just
Okay.
pain shooting here.
Yeah. So I'm sure he told you the first cardiac enzyme came back like it was elevated 0.1.
Yeah,
The next one was
that
normal.
Mhm.
And so it's kind of abnormal. My hunch is that the first one was an error. I don't think that was true. We'll keep trending them out and make sure they don't come back up. But typically, if the enzyme is going to be elevated from a heart attack, it's going to stay elevated.
Right.
Or it'll come down, but it'll come down more slowly. So I would expect if it was peaked at 0.1, then it would be 0.8, then it would be 0.6, not 0.1 to 0.05.
Right.
It's too fast. So I don't think that first one was right. Now, maybe she was at the very tail end of a heart attack or something, and that could be true too. But right now, she looks very stable. Vitals all look good. Now, she had this pain. He did a D-dimer, which I'm sure he's explained to you, was elevated. It was 983, which is maybe it's
Yeah.
something, maybe it's not. D-dimer is a test that just shows there's clotting going on. So somewhere in her body, there's clotting, and there's clotting being broken down. That's all it tells us. And so
Okay.
that test, when it's positive, doesn't tell us a whole lot. When it's negative, it means a lot. But when it's positive, it doesn't mean much. So because this chest pain, because the D-dimer, pulmonary embolism is definitely a possibility. However, she's not hypoxic. She's only 96%.
Yeah.
Her heart rate's 71. Now, she was pretty tachycardic when she came in.
Yeah.
When she-
Mhm.
How fast was her heart rate?
It was 123 when I saw it.
Okay.
When I saw it, it was 123, and then it went down to 90 something.
So the chances of a PE is a little higher then, with the tachycardia. That
Okay.
seems, yeah.
How are we going to determine that? Are they going to X-ray her, or are they just going to give her the heparin or whatever the blood
We're just
thinner?
giving her the Lovenox.
Okay.
The test of choice is a CTA, CT angiogram. To do that, I've got to give her a bunch of contrast. I can't do that right now because her creatinine's not good.
Okay.
Her kidneys aren't working very well right now.
No,
No.
she has a ischemic. What is it? What is it you guys got?
Interstem.
Oh, really?
Mhm.
Yeah.
Okay. How long she had that?
2 years.
Yeah.
Okay.
See, do y'all even have her history or anything on file? I mean,
So I looked up what's today. I haven't gone through and done a thorough
Yeah.
review yet.
yeah.
Yours is 2 years?
No,
Yours
yours.
is 2
Oh,
years.
mine is.
I've had mine. Yeah, I had to have my battery replaced. I've had mine about 8 years.
Okay.
Yeah, she's been in kidney failure for I don't know how long because
Yeah.
of
Oh,
her
really?
high blood pressure.
Okay.
Since
See, like,
2013
that's why
that
I'm
I know
concerned
of.
about her blood pressure being so low, but I didn't realize that she was tacky when she come in.
Who's your kidney doctor?
Robinson? Is that who is it?
Oh, yeah,
Who it
Jody.
is now?
Jody.
Dr.
Yeah.
Sokola, yeah.
Jody's
and
awesome,
Jody.
right?
Mm-hmm.
Yeah,
Yeah.
I really like her.
Jody's awesome.
Oh, look at her smile.
She's
Yeah,
always,
I really
I
like
like
her.
her.
I can always get a hold of Jody.
I love
Yeah.
I
Jody.
like her.
Yeah.
So looks like baseline kidney function is about 2.09. That's the lowest number we have recently. Today's 2.8. So it's a little high. Now, so there's something going on. Probably contributes to the fact that she's not eating, probably not drinking much. All of that contributes. So we're gonna give her some fluids. We'll get that better. I can't, even with the baseline creatinine of hers, which is 2, I could never give her enough contrast. If I give her contrast for a CT, then I'll kill her kidneys.
Yeah.
I can't do that.
Yeah.
So the best thing to do is just assume it's a PE and treat it.
Okay.
That's what we're doing. So she's gonna get full dose Lovenox. Good news, like I said, is that she's very stable. So full dose Lovenox, and then we'll keep watching her, treat her. We'll get cardiology on board just because we had that troponin that was elevated.
Mhm.
I'm worried about I don't know if the TIAs or whatever's going on is in the neck, you know. I mean,
Has-
we haven't gotten the full report from the CT. They were
Yeah.
trying to read it to her, and they went across the Roosevelt Bridge and got disconnected.
So,
and Dr. Gerald was going to finish reading it.
so I have the CT right here.
Okay.
So the radiologist going through basically their impression is the things that they're seeing are just generalized changes. As you get older, you see what we call synaptic changes. So I can show you if you like. This monitor is not very good. But what he's looking at, as you scroll through here, you can kind of see these areas in here that are a little more dark.
Mm-hmm.
These are normal folds of the brain. Her folds are just a little more increased. That black area is just more increased than normal. And so what it means is just it's just age-related changes. It's normal. Well, it could be, but if you scan any 77-year-old's brain, there's going to be that. This is what you're going to see.
Right. They were talking about some white
So,
matter.
yeah, they said that they found some white
Matter on
findings that she may be having mini strokes.
So just some chronic changes. So some scattered deep white matter hypoattenuation, likely affecting microvascular ischemic scoliosis. So basically over the time it could be the result of TIAs. It could be just the fact that she has atherosclerosis, plaque buildup in those very small arteries of the brain. And over time the parts of the brain that those arteries feed
Are
Kinda
built
start-
up and can't get blood
they
through
don't
them.
get as much blood, so they kind
Yeah.
of die. So so we could call that would be considered vascular dementia.
Yeah. Yeah.
Which is
That's
Oh.
like a balloon that's got sand in it or something clogged up, and you can't get blood through it. You know, like a clotted artery.
and that could cause TIAs. It could
Absolutely.
typically with vascular dementia, you have kind of a stepwise decline. So you start okay, and then all of a sudden you're not so good, and then you're at that level for a little while longer, and then things get a little bit worse, and then you're at that level and then continue to decline. Does it mean there's no Alzheimer's? No, could still be Alzheimer's. The CT is not the best to say what kind of dementia it is.
Well, let me ask you this: since we're here, is there any medications we can start her on for that?
Yeah, so typically with dementia, we like number one, given that it's vascular, she needs to be on a statin, she needs to be on all these medications, like an aspirin, she needs to be on things like that.
Okay. Well, I've got
Well,
Bear aspirin at home.
we do
Okay.
at home.
I did that myself.
So then we need to, we need to see what her lipids are. So we can do that here in the hospital. And then we'll start her on a statin if she's not already on one. Keep her cholesterol down. All these things that contribute to that, we just mitigate those risks. Now, in addition to that, things like Aricept, our medications, kind of cognitive enhancing drugs. Aricept, SSRIs are kind of the meds we choose. They don't, statistically, they may slow progression. Whether they do much is questionable, but it's more anecdotal evidence. And so if you have, it's like I have patients with dementia, and you put them on Aricept, and they seem to be better.
Okay.
But
But you can start her on that here.
we could. I don't see why we
We
couldn't.
need something to
Yeah.
get her started on.
We can.
I mean, because this is going to be weeks before we can get her back into
Yeah.
anybody.
Has Dr. Plum wanted to start anything?
We
Yeah,
haven't been back
certainly.
in. I mean, we just gotten started on anything.
I haven't even seen him.
It's
Okay.
been so long.
She has.
It's
and
been what,
It's been 2
three,
It's been almost a
two,
month.
3 weeks
Oh.
Almost a
ago?
month
We
Okay.
can start some
since we
Aricept.
got started.
Yeah, we can start
And
some
we
Aricept.
just started with the CT. I mean, we
Yeah.
went in and seen him. She goes, "Yeah, I can walk," and she could barely stand up. And now she's gone completely
Yeah.
reversed.
Yes.
Yes.
Okay.
And it was a
She-
CT, and now here we are today.
Okay.
So,
So we've gone down pretty quick.
and she's got a list of what medication she is now taking, because she had told them, I'm taking my medicine, and from February 24th, she started taking her medicine, because these girls thought she was taking medicine, she wasn't. So she's got the list of medicine she is now on, the blood pressure and gout and whatever else Dr. Plum had wanted her to take. And she's
Okay.
only like on 5 or 6 pills. And I've got her on a stool softener like every 3 days, right, girls? Yeah.
Okay. Sorry, the text message.
No, that's
They
fine.
never stop.
That's a physician in his job, so we understand completely. You guys are so busy.
All right. So that's the big thing. We're treating a TI or a PE. We got to rule out her heart. We're gonna keep training those enzymes. See, make sure they don't go back up.
Okay.
How are you feeling right now?
I feel like I could dance out of here.
Oh
Yeah,
yeah.
that's what she's wanting to do is dance out
Yeah,
here. And see, I
that's-
didn't know about a PE because it doesn't hurt when she takes that deep breath. And I've had them in both lungs. So I had to have plasma transfusion. And that's what got me because when she does that, it doesn't hurt.
Yeah.
That's what was
Sometimes they don't.
Okay.
Sometimes they don't.
Okay.
It's not atypical, and you know whether she has a PE or not, it's questionable anyway.
Yeah.
But I can't prove that she doesn't, so I got treated.
Exactly.
Mhm.
Yes.
So-
Very. Yeah, I appreciate that. Absolutely.
Of course.
Because all it has to do is break off and go through the heart, and it's over.
Mhm.
Well, it won't go through the heart. So
It won't?
if it's in the lungs, no. So it's in the lungs, so it comes from
The legs.
the venous side typically.
Okay.
It's gonna come from the legs, and so she doesn't have any big swelling or anything like that. But part of this is we're gonna do an ultrasound of her legs. That'll be part of it. If we see a clot down there, then okay, then we say, yeah, okay, there's a clot there. Likely PE here. Now we can put the two together and we have a root and a cause. So she'll get an ultrasound of her legs while she's here. If we don't find anything, then it's not gonna change anything. We still treat it.
Okay.
So that's where we're at.
All right.
But it's eating stuff. How come you're not eating at home?
She's
She's
not
not
hungry.
hungry.
It's not hungry, huh? Okay. Any history of cancer?
Not for her.
Okay.
But
Well,
Cancer.
Let me ask you this. When she goes upstairs, what are the rules? No visitors, right? Because we just seen something happen in the front there. This guy said that he was
brought his
trying.
wife in
Yeah, she was,
yesterday, and she's in the coma.
and they wouldn't
They
let him
won't
go
let him
see
out.
her. So we didn't know what y'all's rules were if she goes upstairs.
okay. I don't know about that. I'm curious about that.
Hmm.
Because I'm sure I know what
Oh,
patient that is.
he was hot, and I
Yeah,
couldn't
I
blame
felt
him.
sorry
I
for
thought
him.
if that was my husband up there, I'd
We,
be
we are
bawling.
allowing visitors, so there's something else to that I don't know what it is.
Hmm.
Um,
Okay.
We do have visitors during the day. We have visiting hours right now. We do have patients right now that have feeling to stay overnight too.
Okay.
So
I didn't know.
I don't want to promise you anything because
Okay.
unfortunately I don't have
Probably
that kind
the
of power.
circumstances, you never can tell.
But during the
you know.
day, absolutely,
Okay.
we let visitors up.
Okay. I
Typically
just
just
wanted
one.
to see. Okay.
Yeah, that's
So-
what she said a while ago, like one visitor at a time.
Yeah, and I would let you guys all.
Like we've had our shots and
Yeah, I'm
everything.
good.
So
She's good.
yeah.
She's good.
This brat we can't
This
get to
one.
take one.
This
I
one.
I guarantee if she ever catches ours, she's gonna be sorry. Hey, if you got a video of anybody suffocating trying to breathe, show it to her.
Well, we can go.
Scare the life out of her.
We can go walk through the COVID hall if you want to.
Yeah. Shake. Hey, take her. Show her. Scare her. Scare her for me. I'm telling you, that's what it's going to take. I'm trying to scare my little sister to put life back into her, not want none of that.
Gotta listen to your belly.
I guarantee you, I had another doctor here, he'd take you down that COVID hall and show you real quick, make you get that COVID
if
shot.
he wasn't busy.
Yeah, he's busy. That's all it is.
Squeeze my fingers for me. Squeeze them real tight. Good. Pull me towards you. Can you push me away? Lift this leg up off the bed.
Yeah, we got an issue too we want to talk to you about.
Okay. How about this one? Lift it up, up, up. Okay.
I can't get it up.
Just this. just this.
He got it.
Just this one.
He still got it.
All
I
professionalism is
couldn't
just going out
get
the window.
it
You can't lift this one. There we go. Okay.
Professional. He is a professional. Bless your heart. She's still.
All right. What else?
Okay, she's got this thing. We don't know if she's got Parkinson's, MS, or what. Bless her heart.
Just when she stands up.
No, she's
Trying to get out of the bed,
bed.
and just her legs
The,
and
the
stuff.
legs are just.
We don't know if she's getting MS, Parkinson's.
Does it happen when she just sits still, or just when she's trying to get up and
No,
move?
she can be sitting
All
in
the
her
time.
chair,
I mean,
you know.
I'm surprised it ain't.
So we don't know.
Okay. Anything with the hands?
Sometimes.
Yes, sometimes.
What do the hands do?
Same thing. You know, she can't like screw something in like.
Mm-hmm.
So I don't know if it's the dementia or if it's a Parkinson's or if it's a.
So Parkinson's will be a tremor at rest. So when they're sitting there, not doing anything, they'll
Yeah.
be rolling
Yeah.
their hands. But
Oh, yeah.
But typically when they
Yeah.
go to reach for something, the tremor will go away, unless it's more advanced. So they'll sit there and they'll roll their hands, and they go to reach for something, and then they have.
You ever noticed her?
Yeah.
Now, if she's trying to reach for things and shaking like this, that's typically a benign tremor.
Okay.
A resting tremor, is what we call it.
I noticed when I put her back on, we made her start taking her medicines, the gabapentin. She used to only take it when her feet hurt, she said. So she would only take it at night. I said, Mommy, you got to start taking it every day. It says to take it every day. It's 600 milligrams. Some of the tremor went away because I read it and it said
Okay.
MS and tremor.
Sure.
Some of it went away. Can they increase that, or is that
Yeah,
the
they
highest milligram?
How much, Sean?
She's on 600 milligrams once a day.
Just once a day?
Mhm.
Yeah, you can go from there.
Okay, so
Yeah.
maybe they need to increase it. It might help the tremors, or
Could.
maybe there's something else going
It
on.
might. Gabapentin might help. If it does, if you've seen it help, then
I've
there's evidence
noticed
that it
an
helps.
improvement, haven't y'all?
Mm-hmm.
But I don't know that's what it is, so I don't want to mask it with the gabapentin. I'm not a doctor.
It's reasonable. It sounds to me like a benign tremor, though.
Okay.
But I haven't seen it. We'll watch her. If we see it, we'll examine it a little more
Well,
closely.
they have the nurses watch, like when she gets out of bed and stuff. When
Yeah.
they go to put her to the restroom or something.
So she
She-
says,
Yeah, she cannot get out of bed by herself.
No,
No,
she
yeah.
can't.
Not
Okay.
at all. She will need alarm. If you know
Yeah.
what I mean.
okay.
Yeah, she will.
All right.
Because she is stubborn.
We can do all that. Can I do anything for you right now?
Yeah, get that thing off.
I can't do that.
I
You
was
asked for
afraid
one-
of that.
You asked me the one thing I can't do.
Mm-hmm.
All right. I'll see you upstairs, okay?
Okay, I'll
Alright.
be waiting on
Thank
that.
Alright.
you so much.
Very welcome.
We appreciate you.
Just pour it out and I'll smoke my cigarette.
See, she didn't do this out. Now that one nurse will come back in here. Like, get her on. Get
I got her.
Well, Jean, get your phone.
I recorded every bit of it.
Jean, get your phone. Now you know we ain't gonna get to do this all the time. We get to laugh at mom.
What's this thing for?
It takes your
Get your
pulse.
oxygen and stuff. Yep.
Your,
Oh, sorry, sissy.
You're all right.
you're good.
Yeah, you want the.
Did you record him too?
Yes, I did.
Okay.
Because I won't, if you ask me 5 minutes from now what
You
he
won't
said, I
remember?
won't know. That's why I do record it. I've recorded both doctors so far.